So with all your due permission, sir, we are good to start.
Yes.
Good afternoon, everyone. This is Batul from IGCP, and I would like to welcome all the viewers who have joined our platform for the better exchange of knowledge that is going to be shared by our keynote speaker, doctor, for today's session. With great honor and pleasure, I would like to introduce the very renowned surgical oncologist, Dr. Bhushan S. Bhargat, sir. Sir is surgical oncologist and consultant surgical oncologist at Shayadri Hospital, Pune. With Sir's help and with Sir's wonderful inputs, we'll be talking about a very important topic for today, which is working woman wellness, breast and cervix cancer. Well, this topic needs a lot of emphasis, and nobody else could be better than Sir to talk about this topic. So before moving on to today's session, let us have a brief look on what the topic says. So in this informative session, as we delve into the crucial topic of breast and cervical cancer awareness, our expert will provide valuable insights, actionable tips, and practical guidance to help working women prioritize their health without compromising their professional goals. So now, without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him for his precious talk to begin. Sir, over to you.
Thank you, madam, for such a great introduction. Working woman is a very volatile criteria of a human being because she is not able to take care of her own health. She has to take care of her household, of her husband, of her children, of her parents, of her in-laws, but her own health is at stake while she is doing all this. So we are going to focus on what specific steps or what specific tests she can get done to screen herself, to prevent herself from a deadly disease like cancer, especially breast and cervix cancer. So let me talk about breast cancer first. What is the most common symptom a lady comes to us, like any doctor or an oncologist to be specific, is a lump in the breast. So what is a lump? A lump is any palpable. By palpable, I mean it should be felt by his or her hand. So any palpable lump or a non-palpable lump. By non-palpable lump means it is found on annual checkups like mammography or sonography. So any of these, whether it is palpable or it is found on any test, that kind of swelling is known as lump, and it is the most common symptom of breast cancer. So what could be that lump? That lump could be any four of these. Like you can see in this chart, that lump could be a fibroadenoma, the lump could be fibroadenosis, the lump could be phylloids, or the lump could be cancer. So these are a bit confusing terms. Let me explain to you that in this table, you will be very clear what these terms are. So if a female is of lower age, like she is between 20 to 30, most commonly it is either fibroadenoma or fibroadenosis. If as the age increases, if the female is more than 40 and comes with a lump, it is more likely to be a cancer than the other two conditions. And the third condition, that is phylloids, you can see it's common in any age group. So the main symptom of fibroadenoma, fibroadenosis, and cancer is lump. Fibroadenoma, phylloids, and cancer is lump, but pain is the main symptom in fibroadenosis. So let me tell you what these terms are. Cancer, all of you know, is the most deadly disease. Fibroadenoma is like a small lump which is come from the breast only, but it is made up of more of fat, or it is more commonly made up from the fibers in the breast or the glands of the breast. It is nothing to worry about. Fibroadenomas are usually benign. They do not convert into cancer, and they can be removed or they can be kept under observation until they are large or until the patient has pain. If a female comes with pain as a first symptom rather than a lump, more commonly fibroadenosis is diagnosed. Fibroadenosis is that is, there are small lumps throughout her breast. There is no specific lump, and there are medicines which can reduce this complaint or this disease. Phylloids is usually the patient comes with a large lump in the breast. It should be differentiated from cancer using other tests, and it is removed. So based on the size, we can see fibroadenomas are usually small, the phylloids are usually large, and cancer can be of any size. The speed of growth is also important. We ask the patient that the lump is since how many months or how many years. So usually fibroadenomas are there since many years. So if a lump is there since many years, it usually is a fibroadenoma. That is, it is not a cancer. But if the lump is very fastly growing, like the patient says that lump has come in 3 months, or has come in 6 months, it is more likely to be cancer. The feel of the lump is important. That is the most important part of examination of the patient when the patient comes to a doctor, whether the lump is soft, whether the lump is firm, or the lump is hard. So if it is soft to firm, it is usually not cancer. But if it is very, very hard, it is very, very fixed, it could more likely be cancer. Like fibroadenosis, I already said the second one, fibroadenosis. There are multiple diffuse lumps in the breast. So the breast feels like a diffusely granular breast. Mobility. The fibroadenomas are usually very, very mobile. Like you have seen the Tom and Jerry. In that, the Jerry is not easily. It doesn't come in the hands of the Tom. It runs very fast. Like that way, fibroadenoma is very, very mobile in the breast. It can be moved from left to right, up to down very easily. Compared to that, cancer lumps are very, very fixed. They can't be easily moved from left to right. The skin over the lump is very important for phylloids, especially. In phylloids, the skin over the lump is stretched because the size of the tumor is very, very large. While in cancer, the skin is pulled inside because the cancer goes and eats upon the skin. So the skin will go inside. While in case of fibroadenoma, the skin is usually normal. So seeing at all these feature, any oncologist or any doctor tries to differentiate between these four and guide the patient accordingly. So every lump is not necessarily cancer, but any lump could be cancer. So if there is a lump in breast, although there is pain or there is no pain, one should get examined from an oncologist. Now, if there is a pain, the second most common symptom in a breast patient is pain. First is lump. So that pain could be intermittent, it could be continuous, it could be associated with or without her periods. Please remember, usually painful things are not cancer, but this is not a hard and fast rule. Cancer can also have pain. So if there is a pain, it does not mean that it is not cancer. Pain can also occur in cancer, but usually we think that if pain is there, cancer usually is not the diagnosis. The third symptom which a female comes to us is a nipple discharge. So which color, which quality, which quantity of nipple discharge is important? That questions we usually ask to the patients which come to us. So if the discharge is from one side of the breast, if both the breasts are involved, the discharge is less likely to be cancer. If it is from one side, it is more likely to be a cancer. If it is spontaneous, that is, it is coming on its own, it is flowing easily, it could be more likely towards cancer. If it is not spontaneous, that it is only coming on pressure, it is less likely to be cancer. By sanguineous, I mean red color. So if it is a red color discharge, we think about cancer more. Now, in the one breast, there are multiple ducts, like there are multiple openings on the nipple. So if the discharge is coming from a single duct, there is only one single dot is seen on the nipple, it is more likely to be cancer. If there are multiple dots of blood or of any discharge on the nipple, it is less likely to be cancer. So these are the characteristics which we specifically see for or ask the patient when the patient comes to us with a nipple discharge. Other red flag signs of cancer of breast are retraction of the skin, because like I already said, the cancer goes and eats upon the skin. So skin goes inside, that is retraction of the skin or retraction of the nipple is also a sign of cancer, although lump is there or not. So retraction of skin and nipple is an important red flag sign of cancer. Another important sign is comparative change in breast size. So if suddenly you feel that within 3 months or 4 months, although there is no lump, but there is a comparative change of one breast compared to the other, should get examined from the oncologist. Now, what are the risk factors for breast cancer? Who are more likely to get breast cancer? This is not a hard and fast image. Anybody is susceptible to breast cancer. There is a risk of 5 to 8% in a general population. That is, any general lady has a 5 to 8% lifetime risk of getting breast cancer. Everyone does not get it. We do not know who will get it, but these patients who are, you can see in the image, are more likely to get breast cancer. Let us see in short what is the more characteristic features who are likely to get breast cancer. First, gender. Obviously, females are more likely to get breast cancer. Second, age. If the age goes more than 40, they are more likely to get breast cancer compared to the female who are less than 40. Having no children throughout their life. Although there are some patients who have had pregnancies, but they are not able to complete their pregnancies, and the children are, they have to abort, and that is not considered as a complete pregnancy, and these females are also likely of having breast cancer. So having no children, Having genetic factors, like if there is a familial history, if the aunt of the patient is having a breast cancer, and now this lady who has come to us is having a lump, we specifically test for breast cancers in those females. Giving birth at an older age is also one of the risk factor. Early menarche, by menarche means when the periods have started. Like if normal age group when the periods start in any female is between 8 to 14. So if there is a early menarche, so if it is very, very early, like 8, 9, or 10, there is a more chance that she might develop breast cancer later on in her life. Late menopause, like if normally age group between 45 to 55 have a menopause, stoppage of menses. If there's a delay in menopause, delay in stoppage of menses, these are also more likely to get breast cancer. Using hormone replacement therapy after menopause is also a high risk factor. Apart from that, obesity, eating junk food, lack of exercise also are a risk factor for breast cancer. Overall, this all depends on the amount of estrogen present in the body. So estrogen is a hormone which makes a female female. So that is the most important hormone in the female, which gives a feminine touch to the human being. So if that estrogen is in more amount, which is than what is required, that estrogen is harmful, and that is a high risk for breast cancer. And these all features cause estrogen to rise in the body. Now, family history is very important. If the patient has a lump and has a family history of breast cancer in her daughter, in her sister, in her mother, in her aunts, or in her grandmothers, then it is a high likelihood that she might also suffer from breast cancer. Now, screening. Screening means getting tested. This is a very important line which many people do not understand. Even many doctors do not understand what is the meaning of screening. So, screening, suppose there are two kinds of people. One lady does not have any lump, any problem at all, and one lady has a lump in the breast. Now, both are coming to the OPD. One lady has come because she has a lump. One lady has come just generally for checkup. Now, the one who has come generally for a checkup is come for screening. The lady who has come for checkup because she has a lump does not count as screening. So, screening means coming to a doctor before having any symptoms or without having any symptoms, just for a routine checkup. So, screening for breast lump should be done on every female who has crossed for, these are American guidelines on the screen, but in India, because the rate of breast cancer is increasing nowadays too much, we recommend every female who has crossed 40 years of age to come to a doctor once in a year and get tested clinically as well as by mammography. Clinically means either palpation, by history, by examination, and then again doing a mammography of the patient. So this is meaning of screening. Also, apart from that, every female, regardless of her age, should self-examine her breast in this manner. This image is from internet. You can type breast self-examination on the internet and find this image. This is a very good image showing each and every part, how to examine, how to look, in which lying down position, in standing position, you can examine your breast and you can diagnose lumps very, very early. When it should be done, it should be done every month by every female on day 7 after your menses have stopped. That is on day 12 of your cycle. Best time to examine the breast. Now, quadrant by distribution, this is not important for patients, but for us, that lumps which are coming in the upper and outer side of the breast are more likely to be cancerous. Now, whether to do, now we all hear all these terms because many patients are being diagnosed in our household or in our neighborhood, or our friends are being diagnosed. So these terms come, we hear them, like mammography or sonography. Now, patients are confused which test to be done, whether to do mammography or whether to do sonography. So patients who have crossed 35 or 40 years of age should get a mammography done. Patients who have less than 35 or 40 and having lump, they should get a sonography done. But this is not exclusive. The radiologist can decide whether she wants a mammography along with sonography in any patient, and can diagnose accordingly. But this is a general criteria. I'll skip this slide. This is not for a general public. BERAT score. This score you can find on your mammography report. If you do not find this word BERAT score on your mammography or on your sonography report, please consult the radiologist again and please ask them to give the score, because based on this score, we can diagnose, we can help to diagnose breast cancer. Now, whether to do FNAC or biopsy. So any lump, if we are coming to diagnose, so we have to put a needle inside the lump to know whether, and put a needle and take the specimen outside to know whether this is really a breast cancer or it is a benign thing. So FNAC and biopsy are two terms which we commonly use in medical terminology. FNAC is a small needle, biopsy is a large needle. So we usually prefer a biopsy over FNAC. A larger needle gives a larger chunk. A larger needle helps us do other tests also. And ideally, a sonography guided biopsy should be done rather than directly doing it in the OPD. Now coming to the treatment, very important. Breast cancer patients come to us and they ask what treatment options for us. Is surgery compulsory? They also ask, now we have already been operated, is chemotherapy compulsory after surgery? So yes, all three treatment options are equally important. Surgery, chemotherapy, and radiation. These are the three treatment options for any breast cancer patient. And we decide based on the reports whether to do all three, whether to do only two, or whether only one is required. Surgical oncologist, I operate upon breast cancer patients. So there are, like to emphasize on the surgical part also, there are two types of surgery which any breast cancer patient can undergo, either just removal of the lump or removal of whole breast. Both options are equally effective. The only difference is that if we are removing only and we are saving the breast, radiation has to be taken compulsory additionally. Now, if you are removing the complete breast, there is a less likely chance that radiation will be required, but that all depends still on the surgical report. After the surgery, that will be decided whether radiation has to be taken or not. And chemotherapy, yes, in Indian settings, because the lumps usually patient comes after the lumps are diagnosed. We are not still very educated. People are not very educated to get screening done. So people come after they are having any lumps. So lumps are usually of larger size, more than 0.5 or more than 1 centimeter. And any breast cancer which is more than 0.5 or more than 1 centimeter, chemotherapy has to be taken. This is a dictum. More than 0.5 or more than 1 centimeter chemotherapy has to be taken in a breast cancer patient. So surgery, chemotherapy, and radiation are three options for any breast cancer patient. Now coming to the cervix cancer, this was all about breast cancer. For cervix cancer, the most common, let us see the most common risk factors. By risk factors, I mean which patients are more likely to get cervix cancer. First of all, cervix cancer occurs in old age. That is, it is not old, does not mean 80s, 90s. Old age means after 50s or after 60s, cervix cancer rate starts increasing. The most common risk factor is HPV. I hope many people who are listening to this lecture or who are routinely reading news, this HPV is caused by unprotected sexual intercourse. So if like you can see the other risk factors below, HPV is a human papilloma virus. It is a kind of virus which spreads during unprotected intercourse with multiple sexual partners. So if there are multiple sexual partners, there is a high likelihood that patient is contracted HPV, and HPV is a cause of cervix cancer in 90% of the patients. So if there is a multiple sexual partner history, if there is a history of sexually transmitted diseases, this is very likely to convert into cervical cancer in the long run. If other risk factors are smoking, having more than 4 pregnancies, having a family history of cervix cancer, having an immunodeficiency. By immunodeficiency, I mean some disease which is causing immunity to come down, like AIDS, or if the patient unfortunately has undergone any transplant, organ transplant, patient has to take some drugs or medicines which is causing immunity to come down. These patients are high likelihood to get cervix cancer. So now how to prevent ourselves from cervix cancer? Cervix cancer, like I said, 90% of the cases are occurring due to HPV, this virus. So first and foremost, removing the risk factor, that is removing the HPV or trying to prevent the HPV, what we can do is get vaccinated. Now, when to get vaccinated? A vaccination can be best done between 9 to 12 years of age. Every female child who is 9 to 12 years of age has to get vaccinated with one of these two vaccines. Nowadays, there is one more vaccine which is being developed indigenously in our own country. Uh, uh, Recently in the news, it was there. We can also use that vaccine for preventing from cervix cancer. Now, if the female has not taken the vaccine at 12 years of age, she still can take the vaccine before her marriage or before her first intercourse. Now, If the female is already married, is already had her first sexual intercourse, vaccination still can be slightly effective until 45 years of age. So a female who is up to 45 years of age, this vaccine will somewhat still be useful for her. So it is advisable, best to take between 9 to 12. If not, take before marriage or before first sexual intercourse. If still not taken, you can still take it up to 45 years of age. The benefit decreases as the age increases. Now, if you have although taken the vaccine or you have not taken the vaccine, screening is important. Like before any symptoms of cervix cancer come, what are the symptoms of cervix cancer? In short, I would like to tell: bleeding, heavy bleeding per vaginum, or white discharge which is not stopping with antibiotics, or there is pain during intercourse, pelvic pain during intercourse. These might be symptoms of cervix cancer. So how to screen yourself is doing a pap test or a HPV DNA. So pap smear test, which we all hear very commonly, is a test done, like you can see in the image. A speculum is inserted and a swab is taken from the cervix, which is sent for testing. Now, who should do it? Every female who is crossed 21 years of age should get a pap smear test until she is 65. When it should be done? It should be done once every 3 years. Now, if you are doing a HPV DNA test, which is similar to this test, for sample collection, it is similar. The reports are different. So HPV DNA test, if you are doing, it is a bit costlier than PAP, but it is not very, both these tests are not very costly. HPV DNA, if you are doing, you can do it once in 5 years. The criteria or age group remains same. Every female who has crossed 21 should get this test done from an oncologist or from a gynecologist. This was all about breast and cervix cancer. Just to give a touch on the important question which the patient asked: what is the stage of cancer? I've added this one single slide before I end my presentation. So what are the stages of cancer? Numerically, there are 4 stages. For medical professionals, we talk in 4 stages. But to simplify for general public, you can say that it could be into early stage, in moderate stage, or in advanced stage. Early stage means you can see a red dot there. These are the various organs in the body. You need not go into specific details, but you can see that red dot is limited to that one organ. So in this case, that is called as the early stage. Now you can see that red dot has increased and involved 2 organs, one below and one above. The stomach is also involved. So that is known as locally advanced or moderate stage. Now you can see there are 4 dots. 4 of them are at different locations in different organs. Now that is known as metastatic stage or stage 4. So just an additional slide, so that because many people want to know what is the meaning of stage and how many stages are there, I have added this slide. This was all about my presentation about working woman wellness, about breast and cervix cancer. Thank you for your time. This is my contact number on the screen. You can contact me on WhatsApp on this number if you have any personal queries or you have any patients regarding these cancers. Thank you so much. Now we can go for question and answer session, if any.
Thank you so much, sir. Thank you for your presentation and for delivering the talk on such an important topic and emphasizing about this. This is a very crucial and volatile topic for women, especially because they have to handle both professional and personal life, but they themselves forget to take care of their health. So thank you so much for emphasizing upon this topic. We have received a few questions that I would like to put across to you. The first question has been received by Dr. Suman. Ma'am, Dr. Suman ma'am wants to know what is the most common complication of MRM in lymphedema? How can it be managed?
So yes, MRM is a modified radical mastectomy. This is a surgery in which the whole breast and the axillary lymph nodes are removed, and lymphedema can occur if the lymph node dissection is done excessively. So there is a limit to how many lymph nodes have to remove. There is a limit to which area have to be removed in the axilla. So if that is done above the, I guess Suman is a medical professional, so she is very specifically asked this question. So if we go above the axillary vein while removing the axillary lymph nodes, that might cause more amount of lymphedema. The way to prevent is, the best way is to use sentinel lymph node biopsy. By sentinel lymph node biopsy, we can know whether actually axillary node dissection is required or not. And if it is required on sentinel node biopsy, you have to stay below the vein. You should not strip away the axillary vein. And if at all, even after doing this, there is a slight chance of lymphedema. There are multiple lymphedema counselors or lymphedema physiotherapists who can help reduce lymphedema using manual compressions, or there are machines used for lymphedema compressors. They can help relieve lymphedema. I hope I have answered adequately.
Thank you so much, sir, for answering this question. We will move to the next question that we have received. And the question is from Dr. Malik. Dr. Malik wants to know the BCS treatment.
BCS treatment.
Yes.
Okay, so for any breast lump, like I said, surgery can be done in two ways. One is removing the whole breast, and one is removing only the lump. So BCS full form is breast conservation surgery, in which we only remove the lump with wide margins and we conserve the breast. We do not remove the rest part of the breast. That is known as breast conservation surgery. The axillary part depends on the sentinel lymph node biopsy, like I previously answered. So basically, BCS is removing only the lump with wide margins and preserving the breast.
Thank you so much, sir. Thank you for answering this question. We have received another feedback from Dr. Madhuri. Dr. Madhuri Bhalgat, ma'am has written very well presentation, very accurate for women for today's time. So thank you so much, ma'am, for sharing your feedback. And we will surely next time will again come with such an interesting topic on women and with sir, so that it helps everybody present at our platform. So thank you so much, sir. That was all for today. And with this, we can conclude the session here for today until next time. And with all your last comments, we would like to conclude the session here.
Thank you so much, ma'am.
Thank you so much, sir. Have a great day.